Hey everyone, you're watching KTAL News Now. I'm your host Anthony Macklin, and today we are joined by Dr. David Rengifo as he is here to talk about liposuction and the safety procedures around it and answers any common concerns that people may have regarding the procedure. Thank you so much for being here.
Thank you, Anthony. I appreciate it. Thank you for the introduction. My name again is David Rengifo. I'm a facial plastic surgeon at LSU Ochsner in Shreveport, Louisiana. And I'm happy to discuss liposuction. It's something that I do specifically in the head and neck area, specifically in the neck area. But most of what liposuction is and most of in regards to the safety profile of liposuction in general is the same for, different areas of the body.
Awesome. And could you explain what the procedure is for people who might not know exactly what goes into it?
Yeah, yeah. So liposuction is a vacuum assisted, sometimes with different newer technologies like radio frequency and laser and ultrasound. But in the most general terms, it is a vacuum assisted procedure in which a small incision is made onto the skin. And that can be anywhere, like I said, in the neck, or it can be in the belly, or it can be in the thighs or in the back. Those are the common areas that are done. And it's a small incision, it's less than an inch. It's about a centimeter, where a cannula is inserted, and that is a blunt steel instrument. And along with the power and vacuum assist that it has, you do directed guided movements of that cannula under the skin to break up the connective tissue with the fat and the skin and suction the fat out of those specific subsets of the body. So it is I like to think of it more of, instead of thinking about fat, it's more of a contouring procedure. And for me, in what I do a lot of times, it is an adjunct procedure. So I do other procedures such as facelift and neck lift along with liposuction of the neck. But speaking for my colleagues who are general plastic surgeons, liposuction can be done isolated. And it is a procedure that can be done under general anesthesia, as in you are asleep, or it can be done under just local anesthetic injection where you are awake, but you are made to be comfortable by having an anesthetic injected into the area. And depending really on the extent of the liposuction, that's what it is. Yep.
And you said that it covers several different areas, like it could be done on a variety of different places. What sort of resources or information is there for people who are might be wondering if this it would be right for them?
Yeah, I think that we're in an age where information is everywhere, and that is fantastic. I have seen and been part of different Instagram videos, TikTok videos, YouTube videos where surgeons, doctors have discussed the use of liposuction. I think that the most important thing that a patient can do is go to the direct website and the direct video resources of the surgeon that they are interested in seeing for liposuction, and you know delving deeper into the information that they may have on their website. They may have videos, they may have before and after pictures, which are really important, and I urge all patients to be able to look at those. They may also have very, very important information that you should really delve into, which is understanding the amount of liposuction that a surgeon is doing. You want your surgeon to have a lot of experience, because this is a procedure that, like I've said before, can be done under general anesthesia, can be significant, can take, it can take a couple hours, it can take an hour, depending on what you're doing. And it can also be a great adjunct to other procedures. Like I've said before, for example, for me, for facelifts and neck lifts, um, but it does come with risks. Everything that we do in surgery, everything we do in medicine is a measure of benefit versus risk. And you want your surgeon to be very well read and very experienced in terms of what they're doing so they understand the risk and the benefits. So that's what I urge people to do because there is so much education out there that is free now, thanks to so many of the social media platforms that we have. I urge you to look up either the surgeon that you are interested in seeing or finding surgeons who are more likely to be on social media. There are surgeons that have a great social media platform, making sure those surgeons are fellowship trained, board certified in their respective surgical fields, and have the experience of this surgery along with any other surgeries you're looking into. So you are getting information from a medical professional. Yeah.
And you were talking about how you have to, pretty much do your own research to make sure that, like you said, you're going with the right doctors, the right surgeons, and everything. But if somebody decides, okay, this is what I want to do, is there anything that they have to do physically to like prepare for it before they do the procedure?
Yeah, I think looking into the videos online, doing your own research to get a better understanding of what liposuction can do for the patient, because it is not really a weight loss or a fat loss procedure. It is more so of a contouring procedure. So for the patient themselves, it's not like they need to know necessarily the specifics of the procedure, but maybe keying in on what it is exactly that they want to have addressed. Along with that, the ideal candidate for liposuction is not a patient who um, is very obese and is in the middle of their weight loss journey. It should be a patient, for example, that has specific fat deposits and areas that can maybe be addressed by liposuction, and a patient who either has completed their weight loss journey now for, a couple months or let's say 6 months, or a patient who at the very least has maintained a stable weight for 3 to 6 months. Because of the nature of weight loss, there are several parts of the body that the fat deposition in the body responds very well to weight loss. Now, in specifics to where I work and what I do in the head and neck, and specifically in the neck where we do liposuction, that area does not actually respond very well to weight loss. So people will have a significant amount of weight loss and still be bothered by the specific fat deposits that they have in their neck, and that's where liposuction can be really, really beneficial. But really, to get back to your question, is have a good understanding of, at the very least, what you want addressed, because there are several options of treatment for everything. But in specifics, the liposuction, more so if you are on a weight loss journey, being at a place where you are maintaining a regular diet that is a healthy diet, and you are exercising regularly, and you've maintained the stable weight now for a couple of months, and that's going to make you a very ideal candidate for liposuction if it's something that your surgeon decides is a good option for you.
And what is the typical timetable when it comes to like right after the procedure? Like, what do they have to do as far as rest, and when can they realistically expect to see like results to their full potential?
Yeah, that's a great question. Depending on the extent of the liposuction, but let's say we're doing isolated liposuction without any other surgery in the neck or in the belly. The patient should expect to have an occlusive dressing placed in around the area where they had the liposuction. Because another important aspect of liposuction is not just the fat that you are removing. That's not what's going to create good contouring results. It's the skin overlying it. So we are decreasing the volume of fat underneath the skin, but the results are really met when the skin basically scars down onto the area that is not as fatty as it used to be, thanks to the liposuction, and that's where you're going to get the result. With that being said, it's really normal to just about everybody that I trained with and that I know from my colleagues does an occlusive dressing. I do an occlusive dressing in the neck where I place a foam basically in your neck and recreate the angle from the area um, under your jaw. And I keep that dressing on for roughly about 4 or 5 days. I see the patient at that point in time. I take that pressure dressing off, and it's very normal for the skin to be a little bit red. It's very normal for that area to be a little bit swollen, and that swelling will start to dissipate and go away by about 2 or 3 weeks, always depending on the patient. And I tell my patients roughly, it may take about 3 months for them to be what I regard as picture ready, where the contouring effects of the skin as it scars down and sits in the right position will really take effect. Sometimes that can take up to 6 months, but really at around 3, 4 months is when the effects of liposuction really start to shine. And sometimes with the swelling, and depending on the sort of the health of their skin, that may take a little bit longer. So anywhere between the 3 to 6 month range.
And you said earlier that, of course, there are risks with this procedure, like with all surgeries. What sort of risks are there that you think people should be most aware of?
I in most of the procedures that I do, I like to kind of differentiate risks into minor risks and kind of expectations to major risks. In terms of the minor risks of kind of expectations, like I've said before, the swelling and the redness of the skin is really going to happen to everyone, and just having the understanding and having the expectation conversation with my patients is of the utmost importance that I have. And that is with this procedure, just like any other procedure that I do, to be honest. And like I said, that will start to significantly improve, into the week and then 2 weeks after. Some of the other risks that can be seen are scarring of the skin that can create some dimpling, some irregularity in the texture of the skin, some firmness in the skin. And there are other risks. There's a risk known as fat necrosis, which is basically death of the fatty cells under the skin. Liposuction is not meant to fully take away all the fat under your skin. You don't want to do that. When liposuction is particularly done in more of an aggressive manner, that's when fat necrosis can happen. That can lead to significant bruising of the skin overlying those areas. And in the specific areas where the fat necrosis can happen, you can have irregularities of the contour of your skin. So you can have like a firm nodule. And it can be pretty disfiguring. And that gets into the moderate, more severe risks. There are other risks such as fluid buildup under the skin, what we call a seroma, and that is because of dead space in the skin. So after the fat is removed, there is dead space in the skin because you've taken out the volume of the fat under the skin. And that is the reason why, for example, I, and like every other surgeon I know, will place occlusive dressings onto the skin because we want to take away that dead space from the outside and allow the skin to scar where it should and create the contour result that we want. But seromas can be common. Unfortunately, occlusive dressings really are the best way to avoid that. Another risk is a hematoma, which is a blood accumulation under the skin. That is rare. Those are encountered fairly early, both of them. Those can be treated in the clinic by either occlusive dressings or pressure dressings, or they can be managed by draining that specific area that has a fluid accumulation under it. And then, the risks that are more severe are things that, I'm sure a lot of people have heard of and they're really scary. And depending on where you are having your liposuction done, those risks are related to injury to the deeper structures. For example, for me in the neck, I always say the neck is an area of high real estate. There's a lot of very important structures of our anatomy that have to do with not just the way that the neck looks, but what the neck does in terms of its movement, the structures of voice, the structures of eating and swallowing. So, there have been terrible reports of people having liposuction in the neck that have had awful injuries to the deeper structures. The same reports have come about from people having liposuction in their abdomen, where the liposuction cannula that it is inserted causes injury to the deeper structures of the bowels or the liver, in the back, specifically the kidneys can be significantly affected. So, those are very, very rare, those severe risks, but they have happened. They can happen. They can happen to a surgeon who does this very frequently, and it is just part of what we deal with in surgery and in medicine. That's why we take it very seriously. And the most important determining factor of having success with liposuction and decreasing not just the smaller risks, but also these very severe, very rare risks is really having the procedure done by an experienced surgeon. It's having it done by a fellowship trained surgeon or a board certified surgeon. you know, th- Cosmetic surgery, liposuction is cosmetic surgery, and it is a very, lucrative thing that I think attracts a lot of people in to provide. And there are unfortunately um, a lot of people who perform cosmetic surgery, who perform liposuction, that are not trained really to do so. They just have the tools and they do it. And, that's where things can go awry. And, they offer it because it's lucrative to them. But what, unfortunately, the only people that suffer in that scenario are the patients. So, I don't want to go down the road of like being very negative about this by any means, but it's really something that as the patient, the best thing you can do is just to look up your surgeon and make sure that they're well trained, make sure this is something that they do, make sure they have their credentials behind them, because that's the person you want to go to for these things. Because most of the time, 98, 99%, you're going to have a great result. You're not going to have any of these risks, whether they're mild or severe. But all it takes is, that 1 or 2% who can have significant setbacks because of a surgery that is not supposed to be, significantly invasive. And that's the big, I think, PSA that I want to give out to the public is just really know who your surgeon is. Yeah.
Yeah, I also don't want to like end it on like a negative thing at
Yeah.
all. So
Yeah.
I was gonna ask you like have do you have any personal success stories or anecdotes from people that you've worked with or that you've made like a positive impact on?
Yeah, I've had, liposuction has really changed plastic surgery. It really has. It's been a great adjunct to us as facial plastic surgeons in the neck. For the general plastic surgeons, it is an amazing adjunct for a lot of different procedures. We're talking about the tummy tucks and mommy makeovers. A lot of patients get incredible, incredible results. And for me, in isolated liposuction, as in I am not doing any other procedure aside from liposuction, I've had fantastic results, specifically in younger women who have isolated, fat depositions in the area under their chin. And no matter the weight loss or the weight gain that they've had, it has remained stable. And it's a really great option because it is a surgery that like I said, is not going to necessitate a ton of downtime. And it can be done in the clinic or in the operating room, depending on the surgeon's preferences and comfort, and depending on the patient's preferences and comfort. And those patients that I've done, for example, isolated on, are incredibly, incredibly happy because, as I noted before, even with significant weight loss, the fatty cells in the area of the neck are fairly um, tolerant in terms of their size and their mass, despite the changes in your body. So I've been really happy. I've used it a lot. I would say way more as an adjunct to other procedures. For example, with neck lifting and face lifting, because a lot of the patients that I see will have significant sagging of their skin, some banding of their neck muscles, and that all happens as we begin to age. All of us will get that. And with liposuction, if they have significant fat deposition under their chin, not just the lifting procedures to tighten those areas, but also to decrease the mass there that is caused by the fat. It really is a great adjunct, and I have had a significant amount of success. On top of that, I also do liposuction to add volume to the face. And that is usually, I take a very conservative amount of fat from the belly or from the front of the thighs. You don't want to take too much fat at the front of the thighs because it can deform the skin a little bit, but you don't really need a lot for the face to create volume. Volume um, equals a younger face. We all lose volume as we start to age. And I have loved doing that. And I add that to just about all of my rejuvenation procedures. Because most of the patients that I have who seek rejuvenation, facelifting and neck lifting also need volume to their faces. And that's something that in the last, year or two, I've really added to my practice. And that's given me great results. Yeah.
Awesome. And is there anything that I didn't ask you today that you wanted to touch a little bit more on?
I know we've already talked about like having the conversation with the surgeons. I think that's the most important part. Um, I mentioned before there are different modalities that are this sort of the same as liposuction with different technologies that have come about. There is laser assisted liposuction, radio frequency liposuction, ultrasound liposuction, and all of those modalities do have great results. It just really depends on what the surgeon is using and what they feel like is giving them the best results. But I urge um, our patients to do a little bit of that research on their own and see what kind of fits them best, and and see what their surgeon, who hopefully is an experienced surgeon that is doing liposuction frequently, is more comfortable with. So sometimes that can create a little bit of a confusion with the patients if it's not necessarily called liposuction. If it's radiofrequency liposuction, that can be a little bit confusing to them. But just so they know that now there are other modalities that are newer, with newer technologies that have given a lot of surgeons really great results, and it's really depending on the surgeon and what they feel like has overall improved their practice and improved their outcomes. Yeah.
Awesome. Thank you so much for joining me today.
Thank you, Anthony. I appreciate it.
And where can people, I guess, get more information or schedule anything once they've made a decision?
Yeah, so it's really easy. We've done our best to streamline having appointments with me and my colleagues. We just opened up a new practice, which I'm super excited about. It's a beautiful practice. It is on Fern Avenue. It's right next to the Whole Foods in Shreveport, so it's a great location. Easy for me to get, like a slice of pizza in the middle of clinic during my lunch hour. And they have all they have to do is call the LSU Ochsner call center, and they once they get on the phone with somebody, which the pickup times are really low. All my patients have huge ease in being able to get appointments with us. They just note that they want to see Dr. Rengifo or any of my other colleagues at the Fern Cosmetic Clinic, and that is immediately sent over to our staff who schedules. So the turnaround time in terms of getting an appointment is very quick. It's a matter of a week or 2 weeks that you'll be able to get an appointment with me. Yeah.
Awesome. Thanks again. That was really, really awesome.
Yeah, of course. Thank you so much. I appreciate it.
And if y'all haven't yet, be sure to visit ktalnews.com, which is where we stream KTAL News Now every Monday through Friday at 1 p.m. But I'm Anthony Macklin, and thank you for joining us.